with Philip Ngotek, who is speaking to us about sexual and reproductive health rights. He's been in the space writing for the Daily Nation on the same as well, and working with non-governmentals. And we're trying to see how exactly we can make sure that sexual and reproductive health doesn't become a taboo topic, menstrual health doesn't become a taboo topic, and how do we fight already the misconceptions around these things. Now, how important is it to fold in the community, Philip, when it comes to having these conversations? Because you can design a school curriculum, you can, do all the wishful thinking. But how do we fold in the communities when we're having these conversations to make sure that they are involved, they feel like they're part and parcel, and they're not just like a bystander when it comes to conversations around sexual and reproductive health for women and girls?
Okay, bringing in the community in this kind of conversation, first we need to bring this kind of maybe example church. Let bring maybe example like nyumba kumi men, whereby watakuja hapo hivyo, then we start talking, then bring girls. Let me say girls because especially on the pitia shida nyingi, because at least women wenye may grow, at least they understand better. So tukileta these girls, at least if they get this information, it will be better for them to understand what is going through them and what will come to maybe kabla janza kupitia. Yeah,
representation at the table, right?
Yeah.
Mapema. Once we get them there, then we are making sure that they're okay. But are there complications that you've seen that could be easily avoided when it comes to women and girls? Anything that has to do with their sexual and reproductive rights, whether it's like early pregnancies, what's usually happening there?
Okay, there's some of complications that zinatokeanga, especially during menstruation. Maybe there are example, maybe someone can collapse, maybe because of this severe pain, meaning we need to have pain management.
True.
Whereby you need to maybe uelewe maana when to chukue something like pills, painkillers, maybe you apply some heat on the stomach, wanatumia kachupa fulani neka maji, then wanatumia maybe hapo kwa abdomen. Also we can do something on maybe atembele maybe medical care, whereby unaenda kuona daktari, because sometimes this cause maybe unaweza kuwa unadhani you have this kind of heavy menstruation,
but it's not normal.
This is normal. Maybe you're suffering from maybe endometriosis.
True. Or
pelvic
PCOS.
inflammatory. Yeah.
Yes.
And this is the thing that we need them to understand. Maybe ndia sishinda akisema maybe I'm going this, maybe it is ni kitu inafaa kupitia hivi, but which is not,
it's not normal.
Yeah, which is not normal. Also we need to do on diet. Wanafaa kukula vizuri, na hapo ndio boy child unafaa kutokea uloteka kitu ka chocolate.
Chocolate kanasaidia na anemia,
na tu banana sapo hivyo. So diet pia waangalie. Maybe food rich with calcium. And
iron.
And iron. It can really help to relieve the pain.
I remember kwanza uko naambia kula beans, penda beans.
But I really like to touch on something. Tuliona one of the senators, Gloria Roba, having billboards and stuff like that, and talking about how she's advocating for stuff. But I think in Kenya, we should have this major push by our politicians and of course legislators. What do you think is best? I've seen countries like Switzerland wanapatianga kitu kama off or during that time. What do you think they should add on to that? And do you think that enough is being done? Maybe we should give response when we come back.